So now I'm going to palpate your sinuses for the presence of infection. Feeling anything there? Any tenderness? Any tenderness? There? Okay. Well, that's something definitely to keep track of then. I noticed that the discharge in your nose is green. So it's possible that you're incubating a sinus infection. And your nose is midline, and that kind of goes in hand with the fact that your septum is not deviated. So let's look in your mouth now and see what we can find. I'm going to ask you to do a whole bunch of things with your tongue.
Okay.
First things first, if you could open your mouth, I'm going to just look inside. All right. So the oral mucosa is light pink. Can you lift up your tongue to the roof of your mouth? Very good. Can you open your mouth wide? There you go. Okay, so the roof of the mouth is pinkish white with transverse rugae. Can I look at your teeth, please? And all of them? Open your mouth all the way. Open your mouth all the way. There you go. The bite is good. All of the teeth meet. Can you lift your tongue one more time? I'm sorry. And I see no evidence of dental caries. Can you show me your gums? There you go. They're whitish pink. How often do you floss?
Not often enough.
Oh, okay. Now, if you can open your mouth wide so I can look at the back of your throat. Stick your tongue out, please. Yeah. Even better. Perfect.
Do I have postnasal drip?
Let me look one more time. Not seeing any.
I feel it right now.
The without a tongue blade, I'm not going to be able to see as effectively as I would like. The uvula is midline. The tonsils are absent, and the back of the throat is pink and moist.
Okay.
Now I'd like you to do some tongue calisthenics for me, please. I'd like you to stick your tongue out and put it to the right after you're done yawning.
I'm sorry. I'm good.
Stick it to the right and to the left. All right, yep. Tongue moves to the roof of the mouth, to the right and to the left, so there's free motion there. I'm going to feel your nodes now. So the first place we're going to start is with your pre-auricular nodes. They're right here in front of the tragus. Tell me if you feel any tenderness. Okay, so nodes are non-tender, non-palpable.
I think it's...
That's tender? So do you think that that is your tonsil-mandibular joint, or do you think that's a lymph node? Because I'm not feeling it.
I think it might be TMJ.
Okay. I'm going to feel the post-auricular nodes, posterior auricular nodes. Is anything tender back here?
No.
Okay. Then I'm going to go to the posterior occipital nodes.
No.
Okay.
No.
And now I'm going to feel the tonsillar nodes. Can you lift your head up, please? Thank you.
No.
Nothing's tender there. And we'll go to the submandibular nodes.
No.
Nothing palpable or tender. The submental nodes.
No.
Nothing. Okay. So now we're going to go to the anterior superficial cervical nodes, and we start at the tonsillar nodes and work our way down.
No. No. No.
Okay. And we'll do the posterior superficial cervical.
Nothing hurt.
All right, give it a minute. I could still poke something that hurts. Okay, now I'm going to ask you to turn your head and tuck your chin. Now, you don't have to be really extreme about it, but just to turn your head and tuck your chin towards your chest a bit. Okay, watch me.
Oh.
Okay, now what I'm going to do is I'm going to feel it's a little too tucked. I got to get my hands in here. I'm feeling your superior clavicular nodes. Okay, and is anything tender in here? Okay. And I'm going to feel the inferior clavicular nodes. Infraclavicular nodes. And nothing is tender there and nothing is palpable. Very good. So your nodes from the head to the clavicle are all non-palpable and non-tender. And that is a good thing. I'm going to now look at your trachea. So what I'd like you to do is hold your head up and swallow for me, please. Okay, so the trachea is midline. The thyroid rises upon swallowing. I'm going to palpate your thyroid. Okay, there it is. Now I'm going to go around to the back, and when I do, I'm going to ask you to turn your head to one side, and then I'm going to ask you to turn it to the other. So now, all right, this is your thyroid. Now turn your head to one side. By that I mean your ear to your shoulder. There we go. And what I'm looking for is to see if one node is, and now the other shoulder. One node is larger than the other, or if anything changes. And you're all set. Thyroid is in good shape. Okay, so now I would like to check the range of motion of your neck. Can you tuck your head to your chest, as far down as you can get it? And I'd like you to look up at the ceiling. Now can you turn your head side to side as though you're looking over your shoulder? And now I would like you to tuck your ear to your shoulder. Both sides. That's as far as you can go? Okay. Okay. Now I'm going to test the strength. Push your head forward. Okay. Push your head back. Okay. Push your head to the side. And now push your head to the other side. Okay. Now try to tuck your head down against my hand. Okay. Try to tuck your head down against. Okay. You have +5 strength in your neck.